let us understand the process of collecting and preparing Wockhardt's Growth Factor Concentrate or GFC from a patient's peripheral blood. GFC is a valuable tool in regenerative medicine and can be used to treat various conditions such as osteoarthritis. To begin the process, we need to collect 4 ml of peripheral blood from the patient in an Ossinext tube. We need to activate the platelets and release the growth factors. We'll do this by gently inverting the tube for 6 to 7 times. And then allowing the tube to stand for 30 minutes. This activates the platelets using Wockhardt's proprietary platelet activating solution present in the tube and releases all the growth factors from the alpha granules present in the platelets. We need to separate the GFC from the rest of the blood cells. We will now centrifuge the tube using Ossinext counterbalance tube at 3400 RPM for 10 minutes. It's essential to counterbalance the tube before centrifugation to ensure the proper separation of pure growth factors from the rest of the blood cells like RBCs and WBCs. After centrifugation, Ossinext thixotropic gel is present between the GFC layer and the red blood cells. This ensures absence of cells in final output. We'll now collect the GFC. To collect the GFC, we'll invert the tube to allow the GFC to get collected at the cap of the tube. Then, we'll insert a needle of the collecting syringe into the tube so that the tip of the needle is just under the cap to allow maximum recovery of GFC. We've collected the yellowish GFC in the syringe, and 2 ml of yellowish GFC thus collected is ready to use. Ossinext GFC can be used to inject intra-articularly for long-term pain relief and regeneration in knee osteoarthritis patients. Wockhardt's autologous GFC Ossinext is approved by FDA and registered with CDSCO.